I've heard of treatment-resistant depression, but what exactly is it?
TRD, or treatment-resistant depression, refers to a group of patients who have not responded to two or more antidepressants.
Up to a third of patients will not achieve a significant response with oral antidepressants. So there's definitely this huge unmet need.
So I'm curious, what makes Spravato different from oral antidepressants?
Up until now, our primary antidepressants have targeted the monoamines, serotonin, norepinephrine, dopamine. The problem is, about a third of people don't respond to those types of treatment options.
In a large-scale study, about 1/3 of patients with major depressive disorder did not respond to two or more oral antidepressants and may be considered to have treatment-resistant depression.
Now with Spravato, we have a different treatment option.
What can I expect at my first treatment?
I try to have a lot of time for patients to ask questions and to give them even material to look at, like the Spravato website, before they even start treatment. If it's their first treatment, we bring them in, get their baseline blood pressure measurement, and then we get them comfortable. We get the trainer device, start going through what it would be like to self-administer Spravato. So this isn't the real medication, but I like you to practice with it.
It has your assigned dose. You lean back, recommended around 45 degrees. You self-administer up one nostril, then the other. You wait 5 minutes to let it be absorbed. 40 minutes after dose, we'll go back in and recheck blood pressure, recheck for any side effects, and we'll continue to do that then for the next 2 hours.
Spravato may cause a temporary increase in your blood pressure that may last for about 4 hours after taking a dose. Your healthcare provider will check your blood pressure before taking Spravato and for at least 2 hours after you take Spravato.
Can you show me what a Spravato treatment center might look like?
In our office, we've taken a pretty simple approach. We have a quiet room where our patients' blood pressure can be monitored. We come and check on them periodically, and we watch them over 2 hours to make sure they've done well with the treatment.
We have a variety of treatment rooms at our treatment center. This is just one of them. We have equipment in here to monitor the patient's blood pressure, a comfortable chair, things like blankets to be able to offer our patients. People can connect their phone and play music. We have the ability to adjust the lighting and a nurse call button in this room so that if patients do need anything, they can call us.
So, is there any important safety information I should know about? Also, what does Spravato treat?
After Spravato administration, some people do become a little bit detached, a little fuzzy, things seem brighter or louder.
Spravato may cause sleepiness, feeling disconnected from yourself, your thoughts, feelings, and things around you, dizziness, nausea, spinning sensation, or anxiety. If these common side effects occur, they usually happen right after taking Spravato and go away the same day.
There's a REMS program that monitors how it's given to make sure it's done in a safe, consistent manner, and to also protect against any abuse or misuse of Spravato treatment. Young adults, be careful with an increased risk of suicide or suicidal behavior with Spravato and or any treatment option for depression. And it's not a treatment for people that have certain complicated medical histories, such as aneurysms, intracranial hemorrhage, somebody with unstable blood pressure. I would not use Spravato in anyone who is pregnant or breastfeeding.
Spravato is also not for use as an anesthetic, and it's not approved for use in pediatric patients. So at 2 hours, if they're stable, their blood pressure is stable, and their mental status is pretty clear, then we let them go home with whoever it is that's providing transportation for them. So Spravato is indicated for the treatment of treatment-resistant depression in adults when used in conjunction with an oral antidepressant.
It is not known if Spravato is safe and effective for use in preventing suicide or in reducing suicidal thoughts or actions. Spravato is not for use in place of hospitalization if your healthcare provider determines that hospitalization is needed, even if improvement is experienced after the first dose of Spravato.
So why is there a 2-hour observation period after taking Spravato?
We watch our patients for 2 hours after they do the Spravato treatment. We look for side effects of sedation, dissociation, nausea, on top of watching blood pressure. And within about an hour and a half, you see that most patients' vital signs, blood pressure, have gotten back to normal. They're awake and alert. And at that 2-hour mark, if all of those have gone back to normal, the patient is then allowed to leave the clinic with the caveat that they cannot drive themselves. No operating heavy equipment, machinery, things of that nature.
Patients have to have a night of sleep before they drive again. I do talk to them about the fact that they might not be as sharp with their thinking, so they want to consider that with regards to any decision making or work that they might try to do after the treatment.
So how often would I take Spravato? What's the treatment schedule like?
So when we break down treatment, the initial phase we call the induction phase. That will be 2 treatments per week for a total of 4 weeks. After the induction phase, which lasts for 4 weeks, you then go into the maintenance phase. During the maintenance phase, you space the visits out. So instead of doing twice a week, you go to once a week. After that, it's really based on your doctor's clinical judgment. You can space out the visits to once a week. You can space out the visits every 2 weeks, depending on your response.
So how quickly might I see improvement with Spravato?
The thing we talk to patients about is that they're not going to get one treatment and feel well immediately. There's a lot of enthusiasm when people come in looking for this treatment, and there's a lot of hopefulness. You want to kind of keep that hopefulness going. You want them to understand that it is a process and it's going to take some time. So laying the groundwork, I think, is also very important and helpful.
Most common side effects include feeling disconnected from yourself, your thoughts, feelings, and things around you. Dizziness, nausea, feeling sleepy, spinning sensation, decreased feeling of sensitivity, feeling anxious, lack of energy, increased blood pressure, vomiting, feeling drunk, and feeling very happy or excited. If these common side effects occur, they usually happen right after taking Spravato and go away the same day.
Can you tell me what kind of success you've seen in your patients with Spravato?
One of my patients who had been stuck in a bad depression, not for months, but for years. And now to see him come in smiling, talking about being with his kids, being with his wife. The day that we did our first Spravato treatment, I just kept thinking about all the patients that we've struggled with throughout the years and how much help this might be for them.
In clinical studies, those who took Spravato plus an oral antidepressant experienced a greater reduction of depression symptoms at 4 weeks compared to those who took a placebo plus an oral antidepressant.
Patients that have been struggling for years, they actually get better. You will see a lot of patients responding. And it has really changed my interpretation of where patients can be.
Before taking Spravato, tell your healthcare provider about all of your medical conditions, including if you have high blood pressure, hypertension, slow or fast heartbeats that cause shortness of breath, chest pain, lightheadedness, or fainting, a history of heart attack or stroke, heart valve disease or heart failure, a history of brain injury or any condition where there is increased pressure in the brain, liver problems, or if you have ever had a condition called psychosis. Important safety information. What is the most important information I should know about Spravato? Spravato can cause serious side effects, including sedation and dissociation. Spravato may cause sleepiness, sedation, fainting, dizziness, spinning sensation, anxiety, or feeling disconnected from yourself, your thoughts, feelings, space, and time, dissociation. Tell your healthcare provider right away if you feel like you cannot stay awake or if you feel like you are going to pass out. Your healthcare provider must monitor you for serious side effects for at least 2 hours after taking Spravato. Your healthcare provider will decide when you are ready to leave the healthcare setting. Abuse and misuse. There is a risk for abuse and physical and psychological dependence with Spravato treatment. Your healthcare provider should check you for signs of abuse and dependence before and during treatment with Spravato. Tell your healthcare provider if you have ever abused or been dependent on alcohol, prescription medicines, or street drugs. Your healthcare provider can tell you more about the differences between physical and psychological dependence and drug addiction. Spravato Risk Evaluation and Mitigation Strategy, REMS. Because of the risks for sedation, dissociation, and abuse and misuse, Spravato is only available through a restricted program called the Spravato Risk Evaluation and Mitigation Strategy, REMS program. Spravato can only be administered at healthcare settings certified in the Spravato REMS program. Patients treated in outpatient healthcare settings, for example, medical offices and clinics, must be enrolled in the program. Increased risk of suicidal thoughts and actions. Antidepressant medicines may increase suicidal thoughts and actions in some people 24 years of age and younger, especially within the first few months of treatment or when the dose is changed. Spravato is not for use in children. Depression and other serious mental illnesses are the most important causes of suicidal thoughts and actions. Some people may have a higher risk of having suicidal thoughts or actions. These include people who have, or have a family history of, depression or a history of suicidal thoughts or actions. How can I watch for and try to prevent suicidal thoughts and actions in myself or a family member? Pay close attention to any changes, especially sudden changes in mood, behavior, thoughts, or feelings, or if you develop suicidal thoughts or actions. Tell your healthcare provider right away if you have any new or sudden changes in mood, behavior, thoughts, or feelings. Keep all follow-up visits with your healthcare provider as scheduled. Call your healthcare provider between visits as needed, especially if you have concerns about symptoms. Tell your healthcare provider right away if you or your family member have any of the following symptoms, especially if they are new, worse, or worry you. Suicide attempts, thoughts about suicide or dying, worsening depression, other unusual changes in behavior or mood. Do not take Spravato if you have blood vessel, aneurysmal vascular, disease, including the brain, chest, abdominal aorta, arms, and legs. Have an abnormal connection between your veins and arteries, arteriovenous malformation. Have a history of bleeding in the brain. Are allergic to esketamine, ketamine, or any of the other ingredients in Spravato. If you are not sure if you have any of the above conditions, talk to your healthcare provider before taking Spravato. Before you take Spravato, tell your healthcare provider about all of your medical conditions, including if you have heart or brain problems, including high blood pressure, hypertension, slow or fast heartbeats that cause shortness of breath, chest pain, lightheadedness, or fainting, history of heart attack, history of stroke, heart valve disease or heart failure, history of brain injury or any condition where there is increased pressure in the brain, have liver problems, have ever had a condition called psychosis, see, feel, or hear things that are not there, or believe in things that are not true, are pregnant or plan to become pregnant. Spravato may harm your baby. You should not take Spravato if you are pregnant. Tell your healthcare provider right away if you become pregnant during treatment with Spravato. If you are able to become pregnant, talk to your healthcare provider about methods to prevent pregnancy during treatment with Spravato. There is a pregnancy registry for women who are exposed to Spravato during pregnancy. The purpose of the registry is to collect information about the health of women exposed to Spravato and their baby. If you become pregnant during treatment with Spravato, talk to your healthcare provider about registering with the National Pregnancy Registry for Antidepressants at 1-844-405-6185 or online at https://womensmentalhealth.org/clinical-and-research-programs/pregnancy registry/antidepressants/ Are breastfeeding or plan to breastfeed. You should not breastfeed during treatment with Spravato. Tell your healthcare provider about all the medicines that you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. Taking Spravato with certain medicine may cause side effects. Especially tell your healthcare provider if you take central nervous system, CNS depressants, psychostimulants, or monoamine oxidase inhibitors, MAOIs, medicines. Keep a list of them to show to your healthcare provider and pharmacist when you get a new medicine. How will I take Spravato? You will take Spravato nasal spray yourself, under the supervision of a healthcare provider in a healthcare setting. Your healthcare provider will show you how to use the Spravato nasal spray device. Your healthcare provider will tell you how much Spravato you will take and when you will take it. Follow your Spravato treatment schedule exactly as your healthcare provider tells you to.